Welcome, everyone. Thank you for joining us for this conversation we're going to have today about the COVID-19 vaccine for children and adolescents. We know how many people are registered for this, and we're going to give about 1 more minute as folks join us. For those who are already on, if you can please just drop where you are joining us from, and then 1 or 2 words about what brings you here. Are you a parent? Are you a healthcare worker? Are you a community worker? Just 1 word where you're from and 1 or 2 words of what brings you here. That'll help our panelists, and it'll help all of us just know a little more who's in the room with us, the virtual room. We have community health workers on, we have parents on, we have grandparents. Thank you all for joining us. We have about 1 more minute and then we'll get started. So several of you wear many hats. Several of you are here representing being a parent or a grandparent, and several of you are also healthcare workers. So thank you in advance for the work that you're doing, the work that you've been doing. So now I will officially welcome you all. My name is Janie Pearl Starks. I'm the Director of Equity, Diversity, and Engagement at Mountain Park Health Center. We're a nonprofit community health center here in the Valley. I'm originally from Guadalajara, Jalisco in Mexico, and have been working in the Phoenix area the last 15 years in the nonprofit sector and city, state, and federal government sectors as well. And I am very excited to help. I'll be moderating this panel today and this conversation, and we will get through the beginning part quickly because we know that a lot of you have questions, and that's going to be a key piece for us. So please, as you have questions, know that we will be answering them as well. When we think about childhood vaccine and adolescent vaccines, the piece that comes to mind is the moment that we were able to vaccinate here at Mountain Park. And that first day we had parents coming and the lines were out the door, and we had parents in tears literally because they were so anxious for the vaccine, either because their children, they lived in a household with their children where someone, maybe a grandparent, was immunocompromised, or in the case of one specific boy that I remember very well, who was battling cancer, and his mom was very afraid to let him leave the house during the pandemic because she knew that that would probably make his situation worse. And so very thankful that we had the vaccine. We know that there was lots of interest at the very beginning, and now interest has tapered off a little bit. And so this conversation is to help us all get more awareness, understand more about the vaccine, the safety of the vaccine, and answer any questions that we know might be out there in the community. Overall purpose, I think we all wear our purpose on our sleeves, but we want more people to get vaccinated, more young people, more adolescents to get vaccinated. So that is the purpose for today as well, in addition to general information about what we can do. So first, we are going to do a quick poll, a 3-question poll. And so for those who have started to join us, please, if you can drop where you're joining us from and 1 or 2 words about what brings you here today. So if you're a healthcare worker, if you're a parent, if you work in education, just let us know that so that our amazing presenters can have a little bit of background about who they're talking to. And so our first poll, if you can drop the poll, please. You should see them coming on your panel, you know. So 3 questions. Have you vaccinated your eligible children? Are you concerned about the vaccine safety? And what side effects are you concerned about? Right. So thank you for completing the poll. So now what I'll do is I will introduce our first speaker, and our first speaker is Dr. Nicholas Staub, and he is a medical epidemiologist with the Maricopa County Department of Public Health. He's board certified pediatric hospitalist and fellow of the American Academy of Pediatrics. He has worked as medical director for the Bureau of Epidemiology and Disease Control at the Arizona Department of Health Services and the medical director for the Division of Hospital Medicine at Phoenix Children's Hospital. He has a Master's of Science in Public Health Microbiology and Emerging Infectious Disease from George Washington University, a medical degree from the University of Southern California, and he completed his general pediatric residency training at Advocate Children's Hospital in Chicago. And so Dr. Staub, thank you for joining us today, and we look forward to hearing from you. Take it away.
Great, thank you, Janie, and thank you to CEAL for asking me to attend and speak to all of you, and thank you to those of you joining this evening. It's a pleasure to talk to you. I will take every opportunity I get, and I get a fair number of them, to speak to a variety of audiences about vaccination. Just as Janie remarked, this has been a roller coaster in terms of COVID vaccine, from the arrival of the first vaccines for eligible healthcare workers to kind of this slower rollout now to eligible teens and kids, and soon hopefully to even in younger kids. So, you know, we've had these kinds of fits and spurts of demand followed by longer periods of lower interest. But we're really, from the county public health perspective, we're taking that time during the periods of lower demand to really reach out and find out where those populations are who have not been vaccinated, and really try to understand what their questions are, so we can answer them, really with the ultimate goal of vaccinating more and more people. So in terms of COVID vaccine for kids, adolescents and younger kids, you know, throughout the pandemic, we've seen that children have been affected differently at different periods of time. So when the pandemic first started and with the early variants that spread, we saw that children were relatively less affected than older people. And because of that, COVID among kids got the reputation that it didn't cause us as severe of disease. Early on, kids only made up about 3% of cases of COVID-19, but that has changed significantly over time. And during our most recent surge with the Omicron variant, we saw children making up 20% of reported cases. So there's been a real significant increase in how COVID has affected kids over time, which makes it even more important that we're having this conversation today about doing the most effective thing to stop COVID-19, and that is to get the COVID-19 vaccine. And again, early on, we saw that kids had relatively mild disease, which I think has driven some to think that, you know, because kids have more mild disease compared to older adults, that they don't need the vaccine. But we're seeing hospitalization of kids. So just in Arizona, through February 17th, just over 4,500 kids have been hospitalized with COVID-19. I say kids, but that's 0 to 19-year-olds, so including adolescents, almost to adults. And again, we've seen the most number of hospitalizations most recently during that Omicron surge, because again, anytime, even if kids are relatively less affected by COVID-19, would you see community transmission as high as what we had recently during the Omicron surge? Even a low risk of being hospitalized is going to result in a lot of hospitalizations just because so many people were getting sick with COVID-19 during the Omicron surge. So another thing that I want to point out here is, coming from public health and from county public health, in Maricopa County, we only have about 25% of our kids ages 5 to 14 vaccinated. So there's still a lot of work to be done, a lot of room to improve on vaccinating our adolescents and these young kids. And we know too that the reason why we had so much transmission, or a lot of those cases, were young adults and including teens. So our chances to really kind of protect the community and decrease that transmission moving forward is going to be through increased vaccination. In my role as a pediatric hospitalist, so as a pediatrician, I only take care of kids who are hospitalized. So that gives me kind of a unique but a fairly limited perspective on kids. So I see really the sicker kids than Dr. Wooten, who will speak with us shortly, than what he sees in clinic. But one of my biggest concerns is around a syndrome called MIS-C, or multi-system inflammatory syndrome in children. And MIS-C generally follows a COVID-19 infection. Again, it's a relatively rare syndrome. There have only been 2,300 cases reported in the US in kids who are 5 to 11. But the sickest kids that I've seen related to COVID-19 have been these kids who present with MIS-C. And again, many different body systems can be involved. We'll talk a little bit about kind of safety and side effects and what most concerns families about getting their kids vaccinated against COVID-19. But something like MIS-C can really affect many different body systems, cause a lot of inflammation, and many of those kids do require hospitalization, some even requiring intensive care. So I bring up MIS-C because, again, most MIS-C cases are following COVID-19. And so the best way to prevent MIS-C is to prevent getting COVID-19. And the best way to do that is to be vaccinated. So we'll talk about some other kind of rare side effects from vaccination, but anytime you talk about the safety or the efficacy of a vaccine, you have to compare it to the safety of the disease it's preventing, right? So we always have to remember that what we're comparing to is not being vaccinated. It's not being vaccinated or not. It's being vaccinated against COVID-19 or getting COVID-19. Because as we saw during the most recent surge, with the high infectiousness that COVID-19 is becoming, your chances are, if you don't get vaccinated, you will be getting COVID-19, and we need to prevent the side effects of that, including MIS-C. Another area that I spend a lot of time in my public health work is working with schools. And we know that schools have really been disrupted during the COVID-19 pandemic, and that kids in school have experienced a lot of disruption. That is going to lead to impacts that we don't fully understand and that we'll be dealing with certainly for many years to come. But with COVID-19 in school, dealing with repeated absences or prolonged absences due to quarantine and isolation, adapting to remote learning, and then just general learning loss over the period of time of the COVID pandemic are just a few of the challenges that kids in schools have faced. Vaccine is a great opportunity for us to get kids back in person learning in school, staying in school, keeping our schools functional by having staff in school and not out sick. Not only does vaccine prevent infections, prevent severe disease, but being vaccinated allows individuals who've been exposed to COVID-19 to not quarantine. And we're in a period of time now where all of these guidance and recommendations are changing very quickly. So I'm happy to address any questions that come up because of that. things may be different tomorrow compared to what I talked to you about today. But again, today vaccination offers you that ability to continue to go to school even after you've been exposed, not to quarantine. So we really see vaccine as a great opportunity to get back to school as normal and kind of get school back on track. I'm going to talk briefly about vaccine safety, and then I'm happy to answer more questions during the Q&A. Vaccine safety has always been paramount to pediatricians and parents alike. The processes by which vaccines are determined to be safe, initially in clinical trials, and then in monitoring of vaccine safety after clinical trials are done and people are being vaccinated. All of those procedures and the groups that oversee it and are constantly doing the evaluation of that safety, none of that has changed during the process of developing and rolling out these COVID-19 vaccines. All of that safety that we have put into place over many decades of research and development have all been in place. There was certainly a fair amount of concern early in the vaccine rollout, and I still hear it about people being concerned about how quickly these vaccines were developed and rolled out. And there were no steps that were skipped. There were some efficiencies that were allowed for. We allowed the drug manufacturers to start producing the vaccine while it was still being studied. So they were able to start producing it and stocking it so that as soon as these vaccines were authorized, and even this most recent vaccine that we're awaiting for kids 6 months through 4 years, that vaccine is ready to go as soon as it's authorized. And it allows for, a scene just like Janie was describing, where you get that authorization from the FDA and the CDC one day, and we start vaccinating kids, people the next day. And it's pretty remarkable. That's not the way this process usually happens, again, because we have allowed for and invested in these vaccines before they've had full authorization. And that was really kind of the process and the efficiency that was built into the system. It had nothing to do with cutting any corners in terms of safety. The other important thing to note is, at this point, how many doses of vaccine have been given. So since authorization, about 8.7 million doses of the Pfizer vaccine have been given to children 5 to 11, and 18.7 million doses have been given to children and adolescents 12 to 15 years. What that means is those are almost 25 million opportunities to observe how these vaccines are affecting kids. We have robust safety monitoring systems. There's 2 different systems. One is called VAERS, VAERS. The other is called vSafe. VAERS is the system for healthcare providers to report adverse events or things that happen after vaccination to VAERS. And vSafe is a program that individuals who are vaccinated can enroll themselves in and describe the side effects that they're experiencing. So in addition to the data that we got about the safety in those clinical trials, we have a lot more data from all these other vaccine doses that have been given that are routinely showing that these are very safe vaccines. And so we have, and because we've had so many doses given, and because we have these robust safety monitoring systems, we have been able to detect very rare but more serious outcomes related to vaccine. And specifically for the Pfizer vaccine, which has been authorized for this population that we're talking about today, the biggest concern is for myocarditis, or inflammation of the heart. And so we have been able to detect some of these cases following vaccination. Usually these cases arise after the second dose in that first series. So not the first dose, but the second dose. We've seen it more commonly in males than females, and in adolescents, not the young kids. So because of that, we are aware of it. We've done a lot of communication with providers. And there's even a very relatively new recommendation from CDC that allows for that second dose to be given up to 8 weeks after the first dose. So the current recommendation is that dose 2 be given 4 weeks after the first dose. There is evidence that shows that if you delay that second dose an additional 4 weeks, so up to 8 weeks, that you decrease the risk for myocarditis after vaccination in a subgroup of population. Again, you're really looking at adolescent males who would benefit the most from that delayed second dose. So that is another example too of how ongoing evaluation of the safety data by both FDA and the CDC has allowed for changes and updates to our recommendations for these vaccines to make them very safe and make sure that they're still effective. The other update to make sure they're effective is the recommendation for boosters. So I would expect as we continue to monitor kids and adolescents under 18 moving forward, that we will see recommendations for a booster dose in that group as well. That is about all I have prepared to speak to. I will be happy to answer additional questions, but I certainly want to let Dr. Wooten address the crowd and then move on to Q&A.
Thank you so much, Dr. Staub. And yes, we'll let Dr. Wooten address everyone, and then we will go into Q&A. I know a couple of you have already submitted questions, so thank you for doing that. And then I'll repeat again, some of you have just joined us now, so please drop where you're joining us from and what brings you here today. If you're a parent, if you're a healthcare worker, if you're a grandparent, if you're a student, we want to know that. And so just like Dr. Staub, Dr. Wooten wears many hats, and he is actually joining us today from Maui. So we want to give extra appreciation for taking time out from his training there to join us today. And so Dr. Wooten is a pediatrician. He's been a pediatrician in Phoenix for more than 35 years. He's the president and CEO of the Wooten Healthcare Group. And he's also a pediatrician and consultant for Valle del Sol Community Health. He's a physician advisor for United Healthcare, Cigna Healthcare, and multiple other healthcare entities. And he's a winner of multiple teaching awards as well as community service awards, including the Thomas Dooley Physician of the Year for Maricopa County, as well as the Calvin C. Good MLK Lifetime Achievement Award for the city of Phoenix. He received his undergraduate training at Northwestern University in chemical engineering and biomedical engineering, and his medical training at the University of Arizona. So Dr. Wooten, the floor is now yours.
Well, thank you. Thank you for having me. And no, I'm not really tired. I haven't been on the beach today, but I do want to tell you that this is a very, very important topic and dear to my heart, as you can imagine. I also want to follow up a little bit of what my colleague, Dr. Staub, said about the vaccine itself as far as approval. And I kind of want to start there because I want to give you some anecdotal history. You know, when I first started practicing in the 80s, gosh, say that 80s, but in the 80s, we saw disease processes that we don't see anymore. I used to see kids with meningococcemia, for instance. I used to see kids with significant Haemophilus influenza type B meningitis. I've had to pronounce, I don't even want to say how many children died from those disease processes in the 80s, late 80s, early 90s. And since vaccination, they're pretty much a dinosaur. You don't even see them hardly ever anymore. I'm going to give you the clinician out in the community's response to the need for COVID vaccinations, and I'm going to parallel it a little bit with some other vaccinations that you know very well. Let's start with varicella. I can remember in 1995, before 1995, when varicella, we didn't even think about a varicella vaccine, and when we came out with the vaccine, people were like, "Why? Why give it? Chickenpox is not a big deal. Chickenpox doesn't cause that bad of disease." Well, indeed, those were people who did not see the chickenpox encephalitis or the chickenpox pneumonitis that could be fatal. And so what we had to do is convince people that varicella vaccine, even though it was only 85% effective, it was truly important because It may not keep your child from getting chickenpox up front, but it kept your child from dying from it. That's the key here with COVID. See, and just to piggyback again on what Dr. Staub said about the clinical trials. In 1995, we had 11,000 clinical trials for chickenpox for varicella vaccine. In a 6-month period after it got full approval, they had given about 2.3 million vaccines. And again, people want to say that, oh, well, this COVID vaccine was just rushed through. I think Dr. Staub did a remarkable job in explaining how that indeed wasn't the case. But this kind of cements it home. So again, varicella in 1995 had 11,000 clinical trials. 6 months after it was approved, full approval, there were 2.3 million vaccines given. The Pfizer COVID-19 vaccine in 2020 had 19,000 clinical trials. I'm going to say that again, 19,000 clinical trials. And 6 months after the vaccine was approved, we had given 186 million doses. So we need to understand and we need to teach our people, our clients, our patients, our families, there's probably never been a safer vaccine ever given. And so we need to shut out the noise and we need to push vaccines in children to the nth degree because yes, they have side effects. Everything that we take has a side effect. But do you know, Dr. Staub mentioned myocarditis as being that significant side effect in adolescent children. Well, in my little fledgling practice in Central Phoenix, Arizona, I have 2 of those very limited amount of children who have myocarditis as a side effect of having COVID. I have 2 in my practice. I really don't know any other pediatricians that have any in their practice that I've talked to, even here in Maui so far in a day and a half. But you're still 4 times more likely to get myocarditis after having COVID than getting myocarditis after getting a COVID vaccine. Say that again, 4 times more likely to get myocarditis after having COVID than after getting a COVID vaccine. So we as physicians, we are in the field for one reason, preventive medicine. Preventive medicine is what we're all about, what we all should be about. And so we have to continue to educate and continue to teach because I told the panel before we started, it is very, very, very disheartening to feel like you're talking to a wall sometimes. People who don't want to hear the truth, don't want to hear the science, but they have to hear the truth and science. Because soon this is going to be an endemic. We know that. It's not going to be a pandemic anymore. It's going to be an endemic. And we're going to be dealing with this virus just like we deal with adenovirus or enteroviruses or influenza, et cetera. It's going to be a seasonal thing. We're going to be dealing with it. We have to push vaccination. Okay. So that's my high horse about that. Now, I do have to say this. MISC is real, but we also know that the vaccines are 90% effective in preventing MISC. Again, vaccinate. We need to vaccinate. I can't tell you how much time. I spend probably 15 to 20% of my day pushing people to get vaccinations. And I'm talking about every day, how important it is, especially the COVID vaccine. So I call it a crisis of 2 years, but it's really been a crisis for longer than that because unfortunately, we still have a lot of people who do not want to hear about the necessity of vaccinations. And I was also telling our group that it's the oddest thing that over the last 2 years, my practice has seen an increase in anti-vaxxers during the COVID pandemic. And I'm not talking about not wanting to get the COVID vaccine for their children. I'm talking about not wanting to get any vaccines for their children. And for the life of me, I can't understand that. It doesn't make any sense, but it's real. And so it's just more of a reason why we have to push and push and push the need for these vaccinations, especially the COVID vaccination. Because as we'll talk about when we answer questions, Yeah, there's symptomatology that is really globally seen with almost every virus that there is, from fever, fatigue, headaches, etc. What I'm seeing now with the children that come in my office with COVID, and by the way, we've been tracking it in my office, about 24% of all sick children I've seen in my office over the last 6 months have been COVID positive, and they're coming to me as a follow-up. That's almost a quarter of all children that I've seen have been COVID positive, and they're just coming to me for a follow-up, which most of us pediatricians know that means they need a note to be able to get back in school. I've written over 500 notes in the last 2.5 months. So yeah, that's a true statistic. I believe me. I every time I have to write, I want to go ahead and get notes printed out, pre-printed, so I can just sign them. But my office manager said I can't do that, so I won't do that. But it is something that we as healthcare providers need to continue to push and push and push and push to make people understand the necessity of continued COVID vaccinations and to understand the relatively the relatively good safety protocol that comes along with these vaccinations. So that's all I wanted to say up front. I know we're going to have a lot of questions, and I promised that I would leave a lot of time for questions.
Thank you so much, Dr. Wu. And yes, right now is a good time. If you have a question, feel free to type it in the chat. And when we started, we did a quick poll, and we will do a poll when we end, but I just want to give you a little bit about what you answered on the poll. So the first question was, have you vaccinated your eligible children? Overwhelmingly, you all said yes, you have. And the second question, are you concerned about vaccine safety? For that, several people were also concerned. So you vaccinated your children, but you're also concerned, which is very fair. And then as far as the side effects, folks were listed several of the different side effects as things you were concerned about. But what we see here is, yes, there are some concerns, but overwhelmingly we know that this is something that helps. So the first question I want to ask, and this is for both of you, do you have children? And if so, are your children vaccinated? Dr. Winston.
Yes, I'll unmute myself and say, yes, I have children. I have 2 girls, and absolutely they're both vaccinated. One is an adolescent in a sophomore in high school, and the other one's a sophomore at that great university known as George Washington University. I thought I would say that for my colleague.
And yes, I am the father of 3 young children, and they have all been vaccinated.
Thank you. And so another question we have is, how much is the vaccine efficacy and how long does it provide immunity for fully vaccinated kids? And do we know that yet?
I'll take a shot at this. So whenever you're talking about vaccine efficacy or vaccine effectiveness, you really have to define what your endpoint is, right? And it's been the goalposts have moved a little bit for COVID vaccine versus vaccines before it, mostly because these vaccines are so effective relative to earlier vaccines that it really was something to be for us to be very fortunate of. But over time, and it's the case with all vaccines, you'll see a trend of decreasing vaccine effectiveness. So whether it's because the virus mutates to become more contagious or more infectious, or because of that immunity that you get from your initial vaccine kind of wanes over time and becomes less, you'll see vaccine effectiveness change. And so we've seen that recently with the Omicron variant. And also with just an extended period of time from when many people had their primary series. So if you're looking at vaccine effectiveness against serious disease, namely hospitalization or death, those numbers look a little different than vaccine effectiveness against getting any testing positive for COVID. And so these vaccines, even without a booster dose, and even Omicron, our most recent variant, have remained very effective at preventing serious disease, so hospitalization and death. And that's always been our #1 goal with vaccine, is not to prevent positive tests, but to prevent severe outcomes from disease. And so that vaccine effectiveness is holding up with these vaccines, specifically Pfizer, and remains very high even months after your second dose, after you've been fully vaccinated. We have seen recent reports out earlier today that the vaccine effectiveness of Pfizer in younger kids for testing positive decreases over time and has decreased with this Omicron variant. And we've all heard that, right? There were a lot of stories. I knew a lot of people who've been fully vaccinated, and then Omicron came, and all of a sudden, my colleagues who were vaccinated and boosted, kids, families I know, everyone started to test positive. Fortunately, many of those people didn't have severe disease. And so that is the vaccine doing what it is supposed to do, not preventing positive tests, but preventing severe disease. And these vaccines are holding up. We know that the technology for the Pfizer vaccine and the Moderna vaccine, this mRNA technology, allows the booster doses and future doses to be kind of tailor fit to some of the new variants that we see. So it'll be very interesting over the coming years to see how that technology helps maintain the effectiveness of these vaccines against future variants.
And to go along with that, will there be a booster dose approved for kids under 12? And then will that be required for kids?
I think that there will be. I'm not the epidemiologist here, but I think that there will be definitely a booster dose approved for children under 12. I think it's going to come probably within the next 2 to 3 months, in my opinion, just looking at the data.
Yeah, I agree with that. What I will say is that the extra bit in there about it being required, again, the vaccines are not required for anyone. And certainly in Arizona, COVID vaccines are not required to attend school. Again, staying up to date on your boosters will give you the highest protection against severe disease. But again, there's no requirement for it, but likely I agree with Dr. Wooten, in the coming months, we'll see that recommendation.
Thank you. And so you both said that your children are vaccinated. Obviously, they're over 5, but there's a question about what about when the vaccine becomes available for those under 5? And I know to some that can be a little scary. It's a smaller kid. What do you have to say to folks that might doubt that or question it?
Well, again, I think I'm tainted a little bit because, again, I remember the days before many vaccines, and I've seen kids anguish with diseases that we now totally prevent. So I'm not gonna mince my words. I'm gonna come straight to you and say, when it is approved for children under 5, I'll be one of the first pediatricians stomping for it. I just will.
And I'll add, there was a brief period of time, a few weeks back, when we thought that authorization was going to come sooner than later. And in public health, we were very excited to see a lot of our vaccinators, a lot of our COVID vaccinators were very quick to sign up and say that they wanted to get that vaccine and start vaccinating those youngest kids. I see the question here in the chat about the safety of COVID-19 vaccine in pregnancy. And I just will take this opportunity while we're talking about those young kids to say, yes, COVID-19 vaccine is safe in pregnancy. It is highly recommended because COVID-19 disease in pregnancy is really bad. And so the best way that a mom can protect her fetus and then her newborn is to get that vaccine while she's pregnant. There's some really cool data out that shows that those kids 0 to 6 months old, where mom was vaccinated during pregnancy, are relatively protected against COVID-19 compared to those kids whose mom was not vaccinated during pregnancy. And so that's the only way that we're going to be able to protect our 0 to 6 month olds. Again, 6 months to 4 years, that authorization is expected here in the next few months.
And so sticking with the baby theme, how long would a baby be protected if the mom got the second dose in their second trimester? Do you know that?
We don't know.
We don't know.
I mean, I'm just going to think we don't really know. We know that passive immunity is there, just like there are many other disease processes that the infant does get passive immunity from the mom, but we don't know. But this is the point I'll raise for that. Any protection is good protection. And so if it's only for 5 months, that's better than no protection. So, but I don't think the data bores out how long the protection is. I don't know, Nick, you have something to add to that?
I mean, other than what you just brought up, we expect that the passive immunity for COVID-19 is similar to other, vaccines that mom gets during pregnancy. I would just add, it is great that it protects the infant, but in the case of pregnancy, it's really the mom. Those moms are at high risk of severe disease with COVID-19. And so the best reason for vaccination during pregnancy is to protect mom, which of course protects the baby as well.
And then with that, if a mom got her booster while she was nursing, does that provide protection? Do we know that one, or is that?
In terms of kind of passing antibody through breast milk, I have not seen that data as strongly supportive as other data.
Thank you. And so one question that we get is, with COVID cases going down, right? We've seen that we peaked a few weeks ago and now cases are going down. Why should a child get vaccinated now if they haven't before?
I'll let Dr. Staub start with that one. You saw me chuckle on that one. Dr. Staub can start with that answer.
So it's the same reason why we start vaccinating against flu before the flu season starts. Again, your intention is to protect yourself before the intruders at the door, right? Your best protection is going to come from developing that immunity from your primary series, right? So for these vaccines, it takes 2 doses in that primary series to build up your full protection. That takes time. If you're an adolescent male and you want to take advantage of this new guidance that says you wait 8 weeks between dose 1 and dose 2, that takes a while. And so your best opportunity to protect yourself from COVID in the future is to get vaccinated now. And again, there's no safety issues that would prevent me from saying, wait. Some people have suggested with the booster dose that they want to wait until one of these kind of tailored booster shots to the next variant is out. And again, it's not really the way the booster works. And so we've been recommending, if you're eligible for your booster, get your booster and get vaccinated.
And then can you remind us who is eligible for their booster?
So individuals who are 17 and older can get their booster dose 5 months after their second dose of Pfizer vaccine. If you are an older individual who received the Johnson & Johnson vaccine, that's 2 months afterwards. And then there are some special situations for individuals who are high risk and immunocompromised. They make these recommendations more difficult literally every week by adding some caveat for some different group. But in general, it's 5 months after your second dose is when most people are eligible for their booster shot.
And then
most people over 17. Over
Correct.
17.
Thank you. Yes, still waiting on those booster recommendations for younger adolescents and kids.
Dr. Staub, I think you mentioned the variants, and I know that folks are keeping an eye on the stealth variant. So is there anything either one of you would like to talk about that? I know there's a lot, again, a lot we don't know, but I know that some data out of Hong Kong is a little bit alarming right now.
Well, we're going to be speaking on different variants from this time on with regards to coronavirus. There's always going to be, I shouldn't say that, but there's going to be variants when we go into the endemic phase of this disease. And it's the thing that we all are going to just have to continue to remember is that we want to be as fully protected as possible because we know even though variants are just that variants, there's still always going to be some degree of immunity elicited from the early vaccinations. So we're going to have more variants, but if you're fully immunized, overall, you're going to do better than those people who aren't immunized. And that's really the name of the game, because there's going to be more and more variants every few months, in my opinion. Maybe not that often, but I can sometimes be a pessimist when it comes to viremia.
Well, and I think the other important thing to remember is variants are driven by transmission. So when we have high transmission, you're going to drive that virus to mutate more, and it's going to take advantage, and it could become more transmissible. It's generally what viruses do. And so if we can control transmission, we should actually start to see fewer variants. Again, they will still happen because it's what viruses do. It's what influenza does. It's why we have a different flu vaccine every year. That's because it's tailored to different flu variants. And so over time, COVID will do that. We're lucky. Coronaviruses in general, compared to flu, are probably easier to protect against moving forward, because their variants aren't quite as drastically different as influenza. But yeah, nothing I've seen about the recent news that we've discussed in public health and with some of the experts in genetics are not particularly concerned about some of these new variants on the Omicron virus or Omicron strain.
Thank you. And so you've provided a lot of information today. And what would you say when you're talking to a parent, or Dr. Stark, when you're talking to a general public, what's a resource or something that you have provided that you found that really resonates with parents? And so what have you found to be particularly helpful or particularly accessible, or just something that really maybe might get someone that's on the questioning or hesitant side across and ready to roll up their child's sleeve?
Well, for me in private practice, as an outpatient private practitioner, sees families that I'm into my third generation now. I've seen families that I saw grandma when she was a 17, 18-year adolescent, and then I saw her children, and now I'm seeing her grandchildren. And the best thing I have going for me is notoriety and the fact we have relationships, because after I give them one of my many vignettes about past diseases and what we had to do about them and do with them, and then how we treated them, and what we're dealing with now with this pandemic and this coronavirus and the multiple strains, they kind of see the picture after a while. They go, yes, I can understand why this is going to be important. Yes, you show me, the history of other viruses, other disease processes, other bacteria. But the key is that they need to have something positive to read. And so I actually do refer them to the American Academy of Pediatrics website. I refer them to the CDC's website. And those that are interested, and I'm finding more and more are, they pick up their iPads or tablets, and they research and look themselves after I've talked about it. And it's made it an easier transition. I still have many people, though, who are they believe that we've just come up with this coronavirus for whatever reason. I don't really know what the reason is, but a lot of people have put a spin on it as it was a moneymaker for doctors and hospitals, and so that they kind of developed it so that they could make more money. Yes, it's something that I've seen ever before, but it just gives me more energy to continue to do what I do, and that's what I plan to do.
And I would simply add, definitely find your Dr. Wooten out there, right? So your kind of trusted primary care physician should be your best resource. They know you, and they know these messages. I think that the Arizona Partnership for Immunizations has a lot of really good resources, and they definitely advocate here in Arizona for immunization. They've been a great resource for us in public health. And then I would just really, I don't want to say which resources I don't want to direct you to, but I think in this era of kind of social media and everyone's on the internet, and there's a lot of different messages out there that are unverified. So I would just be very skeptical of where you're getting your information from. Know where your good resources are, kind of stick to those. And when you find things that work for you, that are good resources for you, share them, share the stories. And that's the way that I think we can get a lot of our still hesitant families around to vaccinating their kids.
And also, speaking of good resources, the group that brought us here together today, the CEAL Consortium, so Community Engagement Alliance Against COVID Disparities, is a group between ASU, U of A, NAU, and the Mayo Clinic. They've brought over 30 community leaders and organizations together to help identify and combat this information and disparities. One thing, Dr. Staub, or Dr. Wooten, that you said, I know specifically in the Spanish community, where Facebook has fact checking in English, that isn't the case in Spanish. So I've had even my own dad who just barely got vaccinated, but he would send me things on WhatsApp and say, hey, is this true? This is what I've heard. And so there's a whole other level. I know that you've done several. The CEAL initiative has done many town halls and many on health disparities. But when we're talking about the disinformation, Dr. Wooten, you hit the nail on the head. Some communities have a little bit more fact checking and some communities don't. So we'll do one final question. We have one final poll for you. And then we will let each of our doctors just give a final word. I feel like that, I don't know what talk show host used to do that, but we'll do just a final word from each one. And so if we can pop up the final poll, please. And then as you're filling out the final poll, I feel like I have to do my due diligence, as you were talking about trusted healthcare providers. I work at Mountain Park Health Center. We are almost past 90,000 vaccines, and we've been vaccinating folks since the very beginning. And we are doing it every single day. So we don't do just vaccine events. Every single day, anybody can walk into any one of our 8 clinics and get vaccinated, anyone 5 and over for your first shot or your booster shot. We're doing it all. So definitely that's one option. I know Dr. Wooten, you're another option. We have several options around the Valley, several trusted places. And the good thing is a lot of us are working together to make sure the community gets vaccinated. And so with that, Dr. Wooten, Dr. Staub, any final words, anything you want to say? I think what I've heard is, things are changing, but the constant is the vaccines are protective and the vaccines are saving lives. And so that's one thing that I keep hearing from both of you. But anything else that you'd like to add?
I just like to add that, well, first of all, I appreciate your having us. And I think this is very, very important topic, obviously. But I just like to add something else, though. It's going to get better. It's getting better. It's going to get better because there are a lot of people out there that are really disenfranchised. There's a lot of people who are really, really down in the gutter, don't feel well. It's, we've talked about it at length. The psychosocial ramifications of this pandemic has been just far-reaching and has really affected children and adolescents more than anything else in my whole career of practice. So it's going to get better, but we healthcare providers have to continue to be diligent to see that it gets better. And I think that we are going to do that.
Yeah, I like that optimism. We're optimistic in public health. We saw those numbers come down pretty steeply after that Omicron surge. And so we're excited to be in a place that is relatively safer with decreased transmission, but we've learned so much over the last 2 years that we can't forget everything that we've learned. A lot about the benefits of telemedicine, especially in our rural and hard to reach areas. And we were just talking today about the benefits of masks, and it's become a real hot button political topic. But it's interesting. Last flu season, and me as a pediatric hospitalist, RSV. Both of those didn't exist last year.
Right.
And that was because of very simple things that we did that can keep our community safer. So COVID-19 was terrible. I want it to go away. I don't ever want to do another pandemic again, but we learned from it. And it's really on all of us to remember those kind of healthy habits that we learned and kind of bring them out every now and again and dust them off, hopefully not too often. But vaccine is one of those things. vaccine will be part of our lives, whether it's COVID-19, flu, or your routine vaccines. So just make sure you're well informed on vaccination and getting those vaccines.
Thank you for that. And again, thank you for everyone who joined us. I know we have people joining us from across the state, and it looks like across the country as well. And so no matter what your role in is this, no matter what your role has been in this, thank you for it, because we know that Dr. Wooten, I giggled a little when you said someone made this up, because I know how hard folks have been working to combat COVID, to educate about COVID, to help people through this, and none of it has been easy. So thank you all for joining us and expanding what you know. Thank you, Dr. Wooten, again for joining us from Maui, and Dr. Staub for another one of your great presentations. And I think with that, a few minutes back.
Thank you.
Thank you.